So I'm David King-Stevens. I'm an epileptologist at Pacific Epilepsy Program at California Pacific Medical Center in San Francisco. It's exciting times these days because there are new medications that are going to be used to treat epilepsy. It's exciting because there are about 15 different medications that work in very different ways between themselves and compared to what we already have. And we're hoping that not only will they have fewer side effects and fewer toxic effects, but also will be more efficient or effective at preventing seizures or controlling seizures. Probably in the next few years, it will be medications that have fewer side effects and less toxicity. And until they're out in the field, we won't know exactly whether they'll have better efficacy. But obviously, the hope is that there will be improvements in the efficacy, because at the moment, most of the medications have about equal efficacy. These medications are targeting different mechanisms that have never been targeted in the past. So, for example, some medications are looking at affecting the endogenous substances that reduce excitation in the brain cells. Others are enhancing the function of these inhibitory molecules that everyone has in their brain. They're looking also at target receptors for hormones, which hasn't been done in the past. Yes, there are at least 3 different approaches using devices instead of using medications that basically use the electrical activity of the brain at trying to control the epilepsy. One of those devices is similar to what has been used for the treatment of Parkinson's disease or other neurological conditions, where it's basically inserting electrodes in a deep part of the brain to try to control seizure activity. That's called deep brain stimulation. A second device is actually looking at anticipating when the seizure is going to occur so that it can deliver the treatment before the actual seizure occurs to try to prevent the development of the abnormal electrical activity. And then the third device that is looking very promising is a device where electrodes are placed in the part of the brain where the seizures come from. And as soon as the device recognizes that there's a change in the electrical activity that signifies that there's going to be a seizure, then it delivers the therapy in the way of electrical stimulation. And when given at the right time with the right amount, it stops the seizures without the person having side effects. So these patients do wear these devices, and they're implanted under the skin, so they're not visible to any other person. And they don't have to worry about having to activate the device. The device runs on batteries, and the device will keep track of the brainwave activity and deliver the therapy based on what the doctor wants to do. So there is a new type of surgery that doesn't involve opening the skin and the bone. It's basically radiation, using very intense and focused radiation with different devices called gamma knife, for example, where once it's been identified the area of the brain where the seizures come from, then radiating that area with this type of radiation that basically burns off the cells that are abnormal but leaves the normal cells intact, is proving to be a good alternative for certain types of surgery where the actual area is removed, obviously with a bigger operation. So this is sort of a non-invasive way of treating epilepsy. So if you're a patient and you would like to learn more about these treatments and whether you would qualify to be participating in one of these studies, the Epilepsy Foundation of Northern California, in their website, will have several links that will take you to either the NIH, the National Institute of Health center that keeps track of all these clinical trials, or to the actual companies themselves that are producing the devices or the medications. And so I would encourage anyone who doesn't feel like their epilepsy is well controlled to definitely take a look at that website.